Question is to the Minister for Health. Will the Minister direct local health networks to revert community health services at Lucindale, Tintinara and Canalpin to the level they were before the changes were made earlier this year? And Mr Speaker, with your leave and leave the House, I'll explain.
Leave is sought. Is leave granted?
Yes, sir. Community health services in these towns have been downgraded and locals are not happy.
The Minister for Health.
Thank you very much, Mr Speaker, and I thank the member for McKillop for his question and for his passionate interest and advocacy on behalf of health services in the Lucindale community, but also the Limestone Coast more broadly. Look, it's very clear expectation from this government in terms of our devolved health system arrangements that we have under the Healthcare Act with local control through our boards. There's an expectation from us as a government that our health networks delivering and improving health services across South Australia, and obviously that includes the Limestone Coast and the Lucindale community. As a government, we have increased the budget quite substantially for health services, and including the Limestone Coast, where the budget is now up to over $201 million for Limestone Coast, and that's a 22.5% increase upon when we came to government under the previous government. So there's an increase of resources that have been made available, but of course we want to make sure that they are delivering results on the ground. Now, there has been a model changes in terms of the Lucindale community nursing services that have occurred over the past year. That's not something that's been directed by me as the Minister or us as the Cabinet or even by the Health Department in Adelaide. This has been through work that's happened at the local level through the Limestone Coast Local Health Network under the auspices of their governing board. And clearly there has been concern, and obviously I appreciate the member today bringing a delegation of some of the residents from Lucindale today to meet with me, including the Mayor of Naracoorte and Lucindale, to meet with both myself but also the Chief Executive Officer of the Limestone Coast Local Health Network, Emma Pollard. And there has been a very clear commitment from the network but also from the government to listen to those concerns and to make sure that we can ensure that the services being provided to the Lucindale community meet the needs of the community. Clearly, there is also an issue in terms of GP access, which goes to what every community in the whole country is facing at the moment, the GP crisis that we need further action from the federal government in relation to. But I think there's a clear number of matters in which further work needs to happen in terms of the Limestone Coast nursing services, one of which is clearly in relation to frustrations that members of the community have found in terms of booking appointments to see the nurses at the Lucindale Clinic, where there has been some work to try to improve that, but the feedback that we've heard today is that's still not working and not to the satisfaction of the representatives that we've met with today. So we need to do some further work to make sure that that's an efficient process where people can book in their services. There was also concerns raised in terms of whether nurses are operating to the full extent of their scope of practice. This is something where the government, as a policy position, we want to see as many nurses as possible operating at their full scope of practice. So that's something that we need to look at further as well. I can report that these services continue to be provided at the Lucindale Clinic, and year to date in 2024 there have been 128 blood tests, 74 wound appointments, 128 vaccinations undertaken through the Lucindale Clinic, which is pleasing to see, but we obviously want to make sure that they're as available as possible. The other element I'd point out is, thanks to the member for McKillop's advocacy, we are undertaking clinical service planning across the region, including Lucindale, and we are open, and the Limestone Coast Local Health Network CEO has made it clear, looking at whether there's options of enhancing services in Lucindale, looking at where we've had some nurse-led clinics operating elsewhere. That is certainly a matter that we'll consider as part of that work for the clinical services plan.